So somebody says, thanks for the information. As for the pastor, so his healing power traveled that time. A businessman of God. This is a response to a video I made where I pointed out that a certain pastor gave a testimony about how he had cancer. A top Nigerian pastor. He went to the US and they performed some operation on him, and he came back and recovered. So he was giving it as a testimony, sharing to the world. So this person is now saying, why is it that the pastor's healing power did not heal the pastor? So first of all, if you go to hospital and got treated, you just got healed. The only thing is that the miracle worker there is the doctor. So doctor treated you. And now from the perspective of the pastor, God made it possible. All right? In many ways. For instance, he made it possible that he had the money to afford such a treatment in another country. And he also made it possible that the man was able to be healed there. All right? The people we don't give credit much to is the doctor. Somebody, let's say it's a surgery. I don't know what procedure he got for the cancer, but let's say it's a surgery. Somebody sat on the operating table with years and years and years of experience. One doctor I was watching the other day said that he has done more than 30,000. He had so many, that is so many surgeries. He said he can even do the surgeries with his eyes closed. With all this experience, this guy sat down and cut you into pieces, extracted something from your body, and stitched you up together, and you're able to wake up and you are healing. We don't give these people enough credit. That's why they are going to on strike in certain countries like Nigeria. We don't respect doctors. Doctors are going on strike. Do you understand? If 10% of the money we send to pastors go to doctors, our medical system will fix itself. We don't need government. We don't need government. If people would come back and say thank you, like you treat somebody, the person will go and come back and say thank you. I once went to hospital with somebody, and the person got treated. After 4 days, he was discharged. I went back the next day to look for the doctor that did that surgery. I was looking for this doctor. When I met him on the hallway, I walked up to him and said, please give me your number. Why I was asking for his number is because I want to shock him. You understand? I want to calculate his salary for 1 year and pay him. Let him be happy. But do you know what this man said? He said no. He said no, he doesn't give his number to patients. I wasn't even his patient. He said he doesn't give his number. I felt bad because in the hallway where we are, I couldn't communicate what I had in mind. But you can see that he said that because he's used to people collecting his number and bringing more problems. If he's used to people collecting his number and sending something to him, he would have been happy to give me his number. But he was protecting his sanity, his peace of mind. In his mind, this guy now will start worrying me about asking me so many questions on WhatsApp. You know? If a doctor treats you, try and go back and say thank you in a special way. If you have millions in your account, shock the doctor. It's not bad to give a doctor an SUV. It's not bad if you have the money. Or give him a plot of land. You know? Give him a house. It's not bad. You don't only give it to pastors. 10% of your income is not bad to give your doctor. After you've paid hospital bills in a separate hospital account. You understand? Call the doctor, collect. What of the nurses? Do you know how much they pay nurses in some African countries? Paltry sum. The nurse will make more money if they are selling puff-puff on the streets. I'm telling you. You understand? If a nurse is taking care of you, call the nurse. Some people have died because the nurse is wicked. If your nurse don't like you, your life is in the hands of the nurse overnight. The nurse keeping watch. If they want to buy you now, you are dead. That drip they are giving you, do you know what is inside? You don't know. You just know they are giving you. She can come at night and put something. You don't die. Do they do autopsy in Africa? Nobody will care about your autopsy. Once you die, they are planning burial immediately. Before you know it, your children are fighting over your properties. Your wife is fighting with your brothers. A fight will start. In Africa, once you die, a fight will start. Call the nurse the ones you can. If you have something, transfer to them. Not 2K, 3K. If you really have something, give them. Let everybody be. Let them go back and take care of their people. Their work is underrated. It's just that the system does not allow them to advertise their success. Do you understand? I believe that, see, doctors, one of the reforms they have to do is to be able to, they need to be able to put the number of lives they have saved beside their name. The way people will say their name and add PhD or engineer, they've partner PhD. Doctors should be able to add Dr. This 1,200. Once you see that number, you know that this guy has saved 1,200 lives. The respect will be more if doctors do that. They should have a national meeting and start adding the number of lives. Hospitals should be keeping record so that they can add it on their name tag. Do you understand? Every year, the number will be reviewed and then updated. So if you are seeing the doctor in the hospital, you show him some respect. Even if it's not within the hospital area, outside. People don't respect doctors in Africa. Because of the lack of respect for doctors, when those people, citizens, eventually become politicians, they don't respect hospitals. A politician will know that he has some disease inside him and he's in control of millions. This same politician that has disease inside him will embezzle the health fund for the state. When he's having health crisis, they will rush him to another state. Do you understand? And when they get to another state, the politician that is leading that other state has already embezzled the money, the health fund. So now they are looking for a private clinic where they can stay for 3 days while they book flights abroad, where politicians don't embezzle health fund. That's where they want to go. The kind of diseases we have now, you will not even see time to book flights. Once in knock you like this, you're going dead. That's how people are collapsing. Once you don't collapse, you're dead. That's what we have now. Maybe to make politicians to wake up. If you know that you are really sick, and you have access to health fund, at least equip the nearest hospital close to you. The hospital in your town, equip it. Do you understand? Because you will not know the day it will stop for you. So I believe that the pastor, I don't think he's one of those fake miracle pastors. Personally, I've not seen his fake miracle. I've seen him praying for people and they're falling, shenanigans and shit. But I've not seen him with fake miracles and stuff. So I think that's part of the reason he's able to come out openly and share that. And he has encouraged other pastors to come out so that people will have sense. In this country, people don't have sense. Somebody will be sick. The money they would have used to get good medical care, they will be splitting it, going from one church to another. You will see somebody sick and they can't move. The family will be dragging them, putting them inside bus and travel 8 hours to another part of the country to go for prayer ground, carry them through prayer ground, stress. At the end of the day, the sick person that is stressed will die. Stress can kill, in case you don't know. The person will die sooner than they should have died. Because of their carrying from one. Meanwhile, if you now start counting, you see that each church they went to have already taken money from them. I used to tell people, it's only a devil that can see somebody suffering and still take money from the person. Like scam the person. Do you understand? If you are paying for something, that's okay. But if you see somebody, a widow, that the husband dies, she doesn't have any money, you still collect the one she has and promise her that you will heal her. That's devilish. We have so many devilish churches in Nigeria. Not just Nigeria, in Africa. Once you come in, they have already designed the system to start embezzling funds from. They will sell, holy water of Nazareth pool. This one, they will sell candle of Lighting International. They will just be selling all these things to you. Before you know it, you have spent hundreds of thousands buying different nonsense. But they know that this thing cannot cure you. You will not want to see pastor. They will not say you have to book appointments. Before you know it, you are desperately committing millions to book appointments. They will ask you, have you joined our church program? Before you can see pastor, have you paid your tithes? Let us check how many tithes you have paid in the past. At the end, they have milked you dry. What will pastor do? Get water and spray you and go his way. The person you are carrying around will still die. So I think what this pastor did is actually good. Let people have sense that pastor himself can still go for medical treatment. Who are you? Many people that have cancer now would have learned from this. Make sure you follow me. Click this